अभी हम स्टार्ट करने लगे एथिक्स, और एथिक्स पूरा PDF ना MCQ की बेस पे है, ठीक है, और ये लर्न भी ऐसे होगा, ठीक है। A 15-year-old girl presented to her GP for contraception. She is having sex with a boy who is in her class. She doesn't want her parents to know because they would be upset. Which one of the following should the GP inform? No one, her parents, police, school, nurse and social service. क्योंकि वो नहीं चाहती कि कोई किसी को भी इन्फॉर्म किया जाए, तो GP ने किसी को भी इन्फॉर्म नहीं करना। क्यों? क्योंकि if her partner is the same age as her or slightly older, you should advise her to tell her parents first. आपने पहले उससे एडवाइस करना है कि वो अपने पेरेंट्स को बताएं. इफ़ शी रिफ्यूजेस, अगर वो रिफ्यूज़ करती है, देन एडवाइज अबाउट safe sex and prescribe the contraceptive pills as long as she understands the aspects of the treatment and it is in her best interest physically and mentally. As the boy she is having sex with nearly has the same age as her, you should not tell anyone if this is what she wants. Okay. अगला है FY2 doctor had received chest x-ray of a patient who has chronic cough. The FY2 doctor considered the x-ray to be normal and thus sent the patient home on proton pump inhibitors thinking that his chronic cough is due to GERD. However, the following day the x-ray was reported by a consultant radiologist which states that there are patchy opacities in the perihilar lungs. The emergency consultants then contacted the patient, started him on antibiotics and wrote his findings on the clinical notes. What should the FY2 doctor do? No changes need to record. Add an addendum to the initial notes, starting new findings with today's ensign. Delete your previous documentation. Since the emergency consultants have already informed the patient and documented his action, the FY2 doctor does not need to do anything. ठीक है, अगर वो डॉक्यूमेंटेड ना होती तो फिर एडेंडम ऐड होता. What should the consultant radiologist do? A 50-year-old woman who is admitted in the surgical ward starts to have shortness of breath. The surgical team suspects pulmonary embolism. The junior radiologist has reported her CT scan as normal. Later on, the consultant radiologist has reviewed the CT scan and found that there is a mass in the left breast. अब कंसल्टेंट रेडियोलॉजिस्ट को क्या करना चाहिए? अब एडेंडम ऐड करना चाहिए, ठीक है ना. स्टार्टिंग न्यू फाइंडिंग्स विद टुडेज डेट एंड साइन, क्योंकि पहले अब उसने ऐड नहीं किया था तो उसे अब ऐड करना है. अगर क्वेश्चन में पहले ऐड किया हो तो कुछ फर्दर ज़रूरत नहीं कुछ करने की. You suspect a college junior doctor to be under the effect of recreational drugs. What should we do? What should you do? कि कॉलेज के जूनियर डॉक्टर हैं अंडर रिक्रिएशनल ड्रग्स. फर्स्ट कन्फ्रंट हिम डायरेक्टली, ठीक है. अगर वो रिस्पॉन्ड नहीं करता तो फिर हमने सीनियर कंसल्टेंट को बताना है, ठीक है. What should you do? A delivering lady had abnormal CTG and thus an emergency cesarean section decision is made. However, the patient refuses to sign the consent. She has a mental capacity and she understands the risk for her baby. तो हमने क्या करना है? उसके विश को एक्सेप्ट करना है और प्रोसीड करना है with the vaginal delivery. In the UK, an unborn child has no rights. ठीक है ना. The husband is unable to consent. It is up to the mother कि वो consent देती है या नहीं देती. What should you do? You stick yourself with a needle that was used to obtain a blood sample from an unconscious patient. You are afraid to get blood-borne disease. What should you do? You need to wait for the patient to become conscious in order to obtain a consent and send a blood sample to investigate for blood-borne infection. क्योंकि आपने अब देखना है कि उस पेशेंट को था या नहीं, तो पहले उसको कॉन्शियस में आने दें, फिर उसके बाद उसका सैम्पल भेजना है. You cannot investigate for infections unless he accepts and consents, except if it is for his best interest. In the given scenario, this sample of blood and analysis are in your best interest, not the patient's. Okay. What should you do? A 15-year-old girl asks you for OCP. Her partner is 35-year-old. She refuses to tell her patient. तो आपने क्या करना है? अब पार्टनर उसका बड़ा है तो कॉन्फिडेंशियली ब्रीच करना है, कॉन्फिडेंशियलिटी और अथॉरिटीज़ को इन्फॉर्म करना है, ठीक है. This is because her partner is much older than her. In this case, we fear child abuse and exploitation. इसलिए OCPs मांग रही है तो कॉन्ट्रासेप्टिव पिल्स. तो हम क्या करेंगे? हम पहले उसको ब्रीच करेंगे कॉन्फिडेंशियलिटी को और उसके अथॉरिटीज़ को इन्फॉर्म करेंगे. If the partner is the same age as her or slightly older, you should advise her to tell the parents. But if she refuses, then advise about safe sex and prescribe the contraceptive pills as long as she understands the aspects of the treatment and it is in her best interest physically and mentally. The legal age is 16. What should you do? A patient was involved in a fight and brought to the emergency uncooperative and with open wound and laceration on the head. Soon he becomes unconscious. तो अब आपने क्या करना है? Proceed to investigation and treatment without his consent, क्योंकि अब वो consent दे नहीं सकता. This is in his best interest. And the case is acute and urgent. Emergency का patient है. An early detection of abnormalities is vital. We cannot wait for him to become conscious, nor can we wait to seek legal advice. What is the next best step to take? You suspect that your colleague doctor is under illicit drugs. So you confronted him, but he denied the allegation. You still suspect he is taking drugs. तो अब आपने क्या करना है? Consultant को, senior को inform कर देना है. Remember, you cannot investigate and gather evidence, as this is unprofessional. You only firstly confront him with advice and secondly inform the consultant. If still not satisfied and still has concerns, raise it to the GMC. What should be done? A pregnant young woman is brought to the emergency by her mother and husband. She has lower abdominal pain and she has active heavy vaginal bleeding. IV fluid and tranexamic acid are given, but the patient is still hypotensive. An urgent evacuation of written product of conception is needed. However, she cannot sign the consent to be taken to the theatre as she is semi-conscious. तो हम क्या करेंगे? Take her to the theatre to save her life without the need for the consent, क्योंकि urgent case है, emergency का case है. This is an urgent and life-saving action. It is in the patient's best interest, so no need for consent. However, you need to document that she is unable to sign. She is semi-conscious in her records. The family members and the husband are not allowed by the legislation to sign on her behalf. You suspect that one of your colleague doctor is under alcohol effect. What should you do? Confront him. और अगर नहीं कर सकते तो senior को inform करना है और फिर inform करना है GMC को. If unsure what to do, seek advice from the medical defense organization. What should be done? A case of paracetamol poisoning is brought to the emergency. She is unconscious. The serum paracetamol level is found to be above the treatment line. What should be done? Unconscious है तो हमने treat करना है without his consent, क्योंकि emergency में आया है और urgent है. And collect collateral information. This is in patient's best interest. Paracetamol overdose could be fatal. NBN acetylcysteine is the antidote for paracetamol overdose. What should you do? A burglar is injured during a gunfire fight with the police. He comes to the emergency and asks you to not to tell the police. What should you do? Inform the police but don't reveal any personal information. अब हमने जो है ना पुलिस को इन्फॉर्म करना है. GMC says that any victims of gunshots who came to the emergency department need to be reported to the police. This is in the police and hospital staff's best interest as a protection and precaution. Revealing their personal details should not really be done in the first contact with the police. Your patient, who is a surgeon, is diagnosed with hepatitis B. He asks you not to inform the NHS trust about his diagnosis. What should you do? Inform the relevant health authorities. He is a surgeon with a blood-borne communicable disease, and there is a risk that his hepatitis transmits to his patients. Therefore, you need to inform the relevant health authorities, as this is in the patient's best interest. A 16-year-old boy with acute appendicitis that requires surgery. The patient agrees on the operation and is willing to consent. However, his parents refuse to surgery. तो अब क्या करना चाहिए? Get a consent from the patient and go for the surgery. ठीक है ना? At 16-year-old, the individual is presumed to have the capacity to consent. Parents cannot override his consent. Under 16, we need to look for the signs of maturity in the individual and his understanding of the situation, so we can decide accordingly whether he is capable to consent or not. Under 13, the individual उसको consider किया जाता है by law as unable to consent. वो consent नहीं दे सकता. Less than 13 consent नहीं दे सकता. 13 to 15 हम देखेंगे कि वो understand कर पाता है या नहीं. ठीक है. Can give consent if they are mature enough to do so. However, if it is not an emergency case and the patient is refusing a life-saving procedure, seek legal advice. Greater than 16 can give consent. A woman who wants to do a laparoscopic sterilization and she understands the risk of this procedure. However, her husband refuses. तो husband को कोई रोल नहीं है. ठीक है. What should you do? Take a written consent from the patient and proceed for the surgery. ठीक है ना? It is her body. The husband has no legal rights to object. This is a surgical intervention. Thus, a written consent is required. A 15-year-old child is brought to emergency by his parents. He has lower abdominal pain. After examination, the doctors suspect appendicitis and decide to admit the patient. Nonetheless, the boy seems to be unable to well understand the complication of the untreated appendicitis. He refuses the admission as he wants to go to a party with friends tonight. On the other hand, his parents want him admitted and willing to sign the consent. What should be done? वो unable to well understand. तो हम पेरेंटल कंसेंट को लेंगे और पेशेंट को एडमिट कर देंगे, क्योंकि वो 15 ईयर्स तो 13 to 15 में हम ये देखते हैं कि वो एबल है, वो क्या बात समझ सकता है। अगर नहीं समझ सकता तो पेरेंटल कंसेंट के साथ जाएंगे। इट इज़ क्लियर दैट द बॉय लैक्स मेच्योरिटी and he is under 16, we can rely on the parental consent. Remember that less than 13 unable to give consent. 13 to 15 can give consent if they are mature enough to do so, and greater than or equal to 16 can give consent. A 15-year-old girl with a large ovarian cyst, the doctor decided to go for laparoscopic ovarian cystectomy. She understands the consequence if left untreated, but she refuses to consent on the surgery. What should be done? Seek legal advice. क्यों? क्योंकि वो 15 साल की है. Although this patient seems to be competent to consent, the case is a life-threatening one, and it is not an emergency case. Therefore, we have time to seek legal advice. The surgery is in her best interest. Child's consent अगर greater than 16 है तो वो consent दे सकता है. अगर 13 to 15 है, if shows maturity and capacity तो able to consent. और अगर refuse करता है, life threatening situation है, तो हम seek करेंगे legal advice. अगर less than 13 है तो unable to consent और parents की consent लेनी है. ठीक है. In a competent patient who refuses the treatment of life threatening condition तो हमने legal advice लेनी है. General note: who can give consent? The patient, unless it lacks mental capacity. The doctor, when the patient is unconscious to decide. The relative, when authorized by the power of attorney. A pregnant woman in early labor with umbilical cord prolapse, the senior obstetrician decides to take her to the theatre of urgent cesarean section. She is unable to consent as she is illiterate. What should be done? Take verbal consent or proceed to the cesarean section. क्योंकि वो illiterate है, पढ़ नहीं सकती, तो हमने verbal consent लेनी है. This is an emergency case. Verbal consent is sometimes appropriate instead of written consent, such as in the case of illiterate patient or the urgency of the operation. Remember to document her verbal consent and the reason for not obtaining a written consent in the patient's medical records. The husband cannot sign on her behalf unless she lacks capacity. Seeking legal advice is not appropriate in an emergency case. 14-year-old girl asks for OCPs. हर पार्टनर इज़ 15-year-old, तो हम OCPs प्रिस्क्राइब करेंगे. तो हम उसको OCPs प्रिस्क्राइब करेंगे और एडवाइस हर टू टेल हर पेरेंट्स. ठीक है. इफ़ हर पार्टनर इज़ मच ओल्डर देन हर, we fear child abuse or exploitation, so we would not tell the police. We would tell the police. ठीक है. और अगर if her partner is the same age as her or slightly older, you should advise her to tell her parents first. अगर वो refuse करती है, then advise about safe sex and prescribe contraceptive pills. As long as she understands the aspects of the treatment, it is in her best interest physically and mentally. The legal age is 16. During surgery, the patient developed cardiac arrest and died. While on the operating table, what should be done? तो coroner को inform करना है. Who is the coroner? An official who investigate violent, sudden or suspicious death. ठीक है. When to inform the coroner? Deaths due to accident, neglect, suicide, violence, industrial disease. Deaths in relation to surgical treatment या anesthesia needed to be referred to the coroner. अगर जो patient है is already out of the theatre, as long as there is a possibility कि जो surgery है may have resulted in death. Sudden और जो unexpected death है, for example within 24 hours of admission to the hospital, उनमें death of an individual who was not seen by a doctor, ठीक है, in the last 14 days of his or her life. Death of unknown cause, deaths during surgery or before recovery from anesthesia, deaths shortly after police custody या फिर prison. What can the coroner consider to be done? Allow the doctors to issue a cause of death certificates and takes no action. Open a post-mortem examination भी वो open कर सकता है. Could lead to open an investigation. Open an investigation quest without a post-mortem examination. Post-mortem examination के बगैर भी वो investigation open कर सकते हैं. Don't forget the patient with mesothelioma need to be reported to the coroner as well, क्योंकि वो एक industrial disease है. Muslim and Jewish families have religious beliefs indicate that the dead should be buried as quickly as possible. ठीक है. So if the suspicious death is for a Muslim, so we also refer to a coroner and inform him that the dead is Muslim, so he can make the required investigation as quickly as possible. Doctors also need to explain the family to necessity of including the coroner and that the procedure would be quick. अगला क्वेश्चन है प्रेग्नेंट वुमेन द सेकंड स्टेज ऑफ लेबर. जो CTG है वो एबनॉर्मल है और वो इंडिकेट करती है फीटल डिस्ट्रेस. द डॉक्टर डिसाइड्स फॉर CS बट द वुमेन रिफ्यूजेस. सिजेरियन है. Women refuse करती है the surgery and wants vaginal delivery despite knowing the risk on the fetus. Her mental capacity assessment concludes that she has capacity. तो क्या करना चाहिए? उसके विश को रिस्पेक्ट करना चाहिए और जैसे वो कह रही है वो वैसे करना चाहिए. ठीक है. क्योंकि अनबॉर्न चाइल्ड का कोई भी राइट नहीं होता. A 90-year-old woman with terminal stage breast cancer with multiple bone metastases. She is on morphine but still in severe pain. Her doctor suspect she has few months to live. The patient discusses ending her life with her family and they agree. She asks you to give her a lethal medication to end her life. She is compos mentis, able to think clearly and to make decisions what should be done. तो इसमें क्या है कि वो एंड स्टेज टर्मिनल स्टेज ब्रेस्ट कैंसर है, ठीक है, और वो 90 ईयर्स ओल्ड है. तो हमने क्या करना है, बेशक जो भी है हमने लीथल ड्रग नहीं देनी एंड टेल हर दैट देयर आर अदर मोर पावरफुल एनाल्जेसिक्स टू एलिविएट हर पेन, क्योंकि वो पेन की वजह से इस तरह से कह रही है, इसलिए हमने कोई भी लीथल ड्रग नहीं देनी, उसके पेन को उसी तरह से रिलीव करना है जिस ज़्यादा पावरफुल ड्रग से रिलीव करना. क्यों? क्योंकि यूथनेसिया यूके में इलीगल है, ठीक है. अ फ्यू आवर्स टू डेज बिफोर हर डेथ एक्सपेक्टेडली डॉक्टर्स कैन गिव पैलिएटिव सेडेशन, सेडेट कर सकते हो उसको, ठीक है. A 15-year-old girl come to emergency with her boyfriend who is 24 years old. She complains of lower abdominal pain. After examination, she is fit to discharge. What should be done before discharging her? तो ये उससे बड़ा है, ठीक है. इट्स अबाउट 24 years old, 10 year एज गैप. तो हमने सेफ गार्डिंग अथॉरिटी को इन्फॉर्म करना है, क्योंकि वो उससे बड़ा है और चाइल्ड अब्यूज़ और एक्सप्लेनेशन का शक हो सकता है. तो हम सेफ गार्डिंग अथॉरिटी को इन्फॉर्म करेंगे. इफ़ दिस वॉज नॉट एन ऑप्शन तो पिक इन्फॉर्म पुलिस. An elderly woman with dementia presents with pneumonia, which soon deteriorates. The doctor decides that resuscitation is not in the patient's best interest as it will lead to a poor quality of life. However, her daughter wants them to resuscitate her. The nurse checked the patient's file and did not find any advance notice or living will related to the DNR. What should be done regarding do not resuscitate order? Involve the patient and her daughter regarding the decision of the DNR, but there is no need for their consent as the DNR is the decision of the doctors only. DNR is डॉक्टर का डिसीजन होता है, ठीक है, पेशेंट और डॉक्टर का डिसीजन नहीं है. This might be strange, but a decision on a DNR order can be made by the doctor even if it is against the patient's wish. या अगर बेशक वो पेशेंट विश के अगेंस्ट भी हो तब भी डॉक्टर ही डिसाइड करेगा कि उसे रिससिटेट करना है या नहीं करना. द पेशेंट इज़ नॉट रिक्वायर्ड टू कंसेंट ऑन अ DNR order. However, the patient and his family need to be involved and to know about the DNR decision. The patient have no right to ask for CPR if the doctors believe that CPR would be unsuccessful or not in the patient's best interest. When are doctors allowed not to resuscitate? If a patient with capacity refuses the resuscitation, respect his wish. अगर वो पूरा के पूरा मतलब अनकॉन्शियस नहीं है और वो कैपेसिटी रखता है और वो रिफ्यूज़ कर देता है रिससिटेशन को, ठीक है, तो हमने उसकी विश को रिस्पेक्ट करना है, ठीक है. इफ़ देयर इज़ एडवांस नोटिस और लिविंग विल दैट सेज द पेशेंट डज नॉट वांट टू बी रिससिटेटेड, तब भी उसको रिससिटेट नहीं करना. इफ़ द डॉक्टर सी दैट द रिससिटेशन इज़ अनलाइकली टू सक्सीड, अगर डॉक्टर को ये लगता है कि रिससिटेशन का कोई फ़ायदा नहीं होगा. इफ़ द डॉक्टर सी दैट द रिससिटेशन इज़ नॉट इन द पेशेंट्स बेस्ट इंटरेस्ट, इट वुड लीड टू अ पुअर क्वालिटी ऑफ लाइफ, तो तब भी रिससिटेट नहीं करना. रिमेंबर CPR इज़ ट्रॉमेटिक एंड कैन लीड टू रप्चर्ड स्प्लीन एंड फ्रैक्चर्ड रिब्स एक्सेट्रा. A Jehovah's Witness man had a RDA and bled massively. In the emergency, he was given IV fluids. However, the doctor see that an urgent blood transfusion is needed. The patient refuses this according to their religious belief. What should be done? तो इसमें accept करना is wish and don't transfuse blood. Many Jehovah's Witnesses don't accept blood products based on their religious beliefs. तो law क्या कहता है? The law says that if they are competent or if they carry the blood refusal card, we should respect their decision not to receive blood products even if this would lead to their death. IV fluid can be given instead. You can advise them to receive blood, but you are not allowed to pressure them to accept it. A man with dementia has large ulcer on his face. He wants it removed as he thinks that this would improve his memory. His wife says that he lacks capacity to consent. What should be done? Refer him to a psychiatrist to assess his mental capacity. क्योंकि उसे डिमेंशिया है तो हमने साइकियाट्रिस्ट की तरफ रेफर करना है. Even if the patient is clearly lacking capacity, documented lack of capacity need to be obtained. 14-year-old girl comes to your clinic and asks for contraception. Her partner is her teacher at school. She does not want anyone to know about her relationship with the teacher and she refuses to involve her parents. तो हमने सेफगार्डिंग अथॉरिटी को इन्फॉर्म करना है क्योंकि टीचर उसे बहुत बड़ा है, वही एक्सप्लॉयटेशन हो सकती है. A 17-year-old boy is brought to the emergency after RTA. He is unconscious. What should be done regarding the initiation of treatment? तो क्योंकि ये अर्जेंट है तो हम स्टार्ट कर देंगे. Begin treatment and resuscitation as needed without his consent. ठीक है, इमरजेंसी है, उसके बेस्ट इंटरेस्ट में हमने देखना है. लाइफ सेविंग एक्ट है. A 15-year-old mentally competent girl asks you for contraceptive device. What should be done? Mentally competent है, As the patient is mentally competent, first advise her to inform her parents. If she refuses तो हमने contraceptive device दे देनी है. However, before doing so, ask her about her sexual relationship and the age of her partner, देखने के लिए कि उसका partner जितना है या बड़ा है. ठीक है. Any of these would be the right answer if given in the options. So cervical smear is not required in the UK until the age of 25 years, even if she is sexually active. An unconscious pregnant woman is brought to the emergency after RDA. She is bleeding massively. Her blood transfusion is urgently required. She carries a witnessed written directive refusing blood and all. तो हम क्या करेंगे? हमने रिस्पेक्ट करना है उसकी विश को ट्रांसफ्यूज़ नहीं करना किसी भी सूरत में. हमने IV फ्लूइड्स दे देने हैं. वही कि जेहोवाज विटनेसेस नहीं एक्सेप्ट करते. A mother of a 14-year-old girl comes to the GP clinic and asks him to prescribe a medication to alleviate the dysmenorrhea for her 14-year-old daughter. The daughter could not come as she is busy at school. What should be done? Arrange an appointment to meet both the mother and the girl together. Mother को नहीं देना. ठीक है. The doctor need to assess the daughter's mental capacity and to take consent from her that allows her mother to take the responsibility of her own health. No prescription by proxy. A patient with multiple sclerosis has taken 40 paracetamol pills to end his life. His wife wants him to be treated from paracetamol overdose. However, he insists not to be treated. What should be done? Assess his mental capacity. ठीक है. Prior to make him consent not to receive treatment, we need to make sure that he is mentally capable to take such a decision. Remember also that he has multiple sclerosis. ठीक है. The neurological manifestations भी हो सकती हैं. An elderly with mild dementia was diagnosed with ovarian cancer. A nurse wants the patient to be involved in a clinical trial and the patient agrees. ठीक है. However, her daughter refuses. Her son has lasting power of attorney. What should be done? To refer to a GP to assess her mental capacity. Mild dementia does not necessarily mean that the patient lacks mental capacity. Even if her son has power of attorney, we firstly need to make sure whether she has mental capacity or not. If the mental capacity assessment shows that she lacks the capacity, then only her son can make the decision and consent. Again, it is her decision in the first place as long as she is mentally capable. तो उसके बाद जो है the power of attorney आता है. ठीक है. GPs, social care workers and healthcare professionals are trained by the Mental Capacity Act to assess the mental capacity for their patients. However, if it is a complex case, a GP, consultant, psychiatrist or psychologist may need to be involved. A pregnant woman is in the delivery room. CTG shows bradycardia that is persistent. A decision for urgent C-section is made. However, the patient speaks only one different language and cannot understand English. Many attempts to provide a translator had failed. What should be done? तो हमने cesarean की तरफ ले जाना है क्योंकि ये emergency situation है. Although the unborn fetus has no right in the UK until he is born, the scenario here did not mention that the mother refuses the C-section, but she only cannot understand English. She did not refuse the cesarean section. If she did understand and refuse, we would not go for the CS. There is no time to continue calling the translation line or to seek legal advice क्योंकि emergency situation इसलिए हमने proceed करेंगे आगे. An elderly woman with Alzheimer's disease comes to the GP clinic with her granddaughter who is her caretaker. And the patient asks you not to prescribe her medications as she has changed her mind on the treatment of her condition. What should be done? तो पहले क्या करना है हमने उसकी जो भी डिजीज़ है मेंटल कैपेसिटी जिनमें ख़राब होती है तो सबसे पहले हमने मेंटल कैपेसिटी असेस करनी है. ठीक है. A 33-year-old woman was found unconscious after receiving her diagnosis of terminal stage cancer. She is brought to the emergency by her boyfriend. The doctor suspects that she has taken a overdose of benzodiazepine. A note was found next to her saying that she wishes to end her life, refuses. What should be done? Initiate treatment, try to save her life. The suicide note is an illegal document. ठीक है. For it to be legal, it must be signed and witnessed. ठीक है. उसको साइन होना चाहिए, उसमें विटनेस होना चाहिए. ठीक है. Also it should include the specific treatment that is refused and the specific circumstances. An elderly woman with dementia had a car accident and she does not remember the accident. What should you do? तो stop driving करानी है और DVLA को inform करना है. If she refuses to inform DVLA yourself as doctor, an elderly woman with Alzheimer's disease continues to drive and refuses to inform, तो आपने DVLA को inform करना है, driver and vehicle licensing agency को. It is the responsibility of the patient to inform DVLA. However, if they refuse to do so, it is now your responsibility as a doctor to inform DVLA. A lady is brought to the emergency by her husband after a car accident. She is deteriorating rapidly and an urgent blood transfusion is required. और जेहोवाज है तो हम ट्रांसफ्यूज नहीं करेंगे without the need of her consent. ठीक है. While you are on a break, you notice one of your colleagues browsing X-ray pictures on his smartphone. You confront him and he tells you that he is picturing X-rays of many patients for his own educational purposes. What should you do? Advise him to delete the images and not to do this again. अगर वो ऐसे करता रहता है तो advise him to tell his clinical supervisor. If he does not obey and continue to practice, inform his clinical supervisor yourself. क्योंकि वो पेशेंट के एक्सरे ले रहा है without their consent. That's why it's illegal. Pages of patient X-ray for education purposes should be anonymized without the name and the other details of the patient. The hospital उस पर कुछ भी पेशेंट का नाम कुछ भी लिखा नहीं होना चाहिए. Picture of the patient faces or parts of the body should not be taken unless a consent from the patient is obtained. ठीक है. A 40-year-old man with learning difficulties present with persistent hematemesis. A decision for endoscopy was made by the doctors. What should be done as the patient has learning difficulties and cannot understand the procedure. लर्निंग डिफिकल्टीज और प्रोसीजर को अंडरस्टैंड नहीं कर सकता तो उसके गार्डियन से लेना है कंसेंट. ठीक है, जिसके पास पावर ऑफ अटर्नी है. पेशेंट हु आर अनएबल टू मेक डिसीजन फॉर एग्जाम्पल ड्यू टू लर्निंग डिफिकल्टीज और मेंटल डिसेबिलिटी हैव गार्डियंस to make legal, health, financial decisions. What if the patient was deteriorating in clinically unstable emergency situation and proceed to endoscopy without consent? ठीक है, क्योंकि emergency situation. A man with HIV refuses to use condoms and refuses to tell his wife about his diagnosis. What should be done? तो हमने breach करना है. Encourage him to tell his wife. ठीक है, अगर वो refuse करता है तो notify his wife through the partner notification program. This program is to notify about the sexually transmitted infections or HIV as a communicable disease. The wife has to know in order to get investigations and proper treatment if required. Firstly, the affected patient is asked to inform their spouse within a time frame. If he or she does not, then the healthcare worker should inform the spouse via the partner notification program protocols. ठीक है. A woman with multiple sclerosis took overdose of tricyclic antidepressant drugs and she is now refusing. तो हम पहले उसकी mental capacity को assess करेंगे क्योंकि वो multiple sclerosis की patient है. A young lady asked the OB-GYN doctor to terminate her pregnancy. Gestational age is 26 weeks. Her reason for this is that she does not want anything to remind her of her boyfriend who used to hurt and assault her. He is now in jail and she is otherwise healthy. What should be done? तो हम refuse करेंगे to terminate the pregnancy. Why? In the UK, abortion is a women's right. It is allowed as long as the gestational age is less than 24 weeks. The husband consent is not needed. In the UK, it is illegal to terminate the pregnancy after 24 weeks of gestation. और ये कितने हैं? 26 weeks of gestation. Except if the continuation of the pregnancy would harm and endanger the mother. As the husband is in jail, there is no need to inform the police. What if she presents with pregnancy before the 24 weeks? Allow abortion and provide her with the details of an abortion clinic. A young female ingested 30 pills of paracetamol in aim to end her life after receiving bad news. She refused to be treated. What should be done? तो हम psychiatrist को refer करेंगे to check her mental capacity to refuse treatment. Remember, we always tend to do what is in the patient's best interest. If she accepts to receive treatment, we would not refer her for mental capacity evaluation. However, if she refuses the treatment, we would assess her mental capacity prior to respect her wish not to treat. A 40-year-old man took 50 pills of paracetamol. The serum paracetamol levels is above the treatment line and acetylcysteine. He, however, refuses to receive any treatment. What should be done? Mental capacity check करनी. A USFY2 doctor found out that your consultant is having a sexual relationship with one of his depression patients. The patient is to be discharged next week. What should you do? Report him to trust manager as per the protocol of the hospital. Remember that doctors are not allowed to make sexual or emotional relationship with their patients or any of the patient's relatives. You should report the incidents to the appropriate seniors according to the hospital protocol. The police should not be involved तब तक unless there is a sexual assault or criminal acts against the patients. A man has a single TIA transient ischemic attack and he is now fit for discharge. What should you advise him about car driving? ठीक है, stop करे for at least 1 month. Stop lorry or bus driving for 1 year plus inform DVLA if single TIA. When to inform DVLA? If car group A driver car and has multiple TIAs within a short period. If group B driver lorry और बस तो फिर सिंगल TIA भी हो तो तब भी उसने DVLA को इन्फॉर्म करना है. Cases of DVT and pulmonary embolism can continue driving without an issue, and as long as you don't lose consciousness and can move their legs freely, they don't need to be reported to DVLA. A young lady comes to emergency with her husband complaining of abdominal pain. She does not speak English and her husband translates to both of you. While examining her abdomen, you found many bruises. The husband tells you that she has fallen the stairs. What should be done? Admit the patient, request an independent translator. क्योंकि ये domestic abuse हो सकता है. Admitting the patient would prevent her contact with her husband, who might continue hurting her. It would also give us a chance to arrange an independent translator via NHS Language 9 so we can understand the real story, as she will most likely speak freely away from her husband. We should not contact the police or safeguarding before knowing the whole story. A patient with a knife injury on his thigh comes to emergency. Later, the police comes and tell you that there is a murder. They are investigating on what should be done. Provide only necessary information after getting a consent from the patient. It is not allowed to let the police assess the patient if this will delay or affect his treatment or recovery. Before disclosing personal information of a patient, ask the patient for his permission and consent, unless if hiding this information would likely put others at risk of harm. A 15-year-old girl presents with mild vaginal bleeding. Pregnancy test is positive. She refuses to tell her parents and she refuses to give any information about her partner. What should be done? तो उसकी competency check करनी to make the decisions. ठीक है. You suspect that your colleague FI2 doctor is under illicit drugs, as same nurses have told you he is hallucinating sometimes and does not complete his duties. You confront him and he admits that he is taking cannabis. What should be done? तो हमने क्लिनिकल सुपरवाइज़र को इन्फॉर्म करना है, क्योंकि कन्फ्रंट कर लिया हमने, उसको कोई असर नहीं हुआ. सीनियर को इन्फॉर्म करेंगे, फिर जीएमसी को. इन सम सिचुएशंस वी कैन नॉट जस्ट गिव एडवाइस एंड लीव इट एट दिस लेवल. दिस माइट endanger patient safety. It is clear that this FI2 doctor is likely to have a psychological illness which may endanger the patient. Therefore, raise your concerns to his clinical supervisor. A 15-year-old girl comes to your clinic with her boyfriend who is 15-year-old. She asks for OCPs. As they are sexually active, they could not be convinced to tell their parents. What should be done? So, advise them about safe sex and prescribe the OCPs. क्योंकि एक जैसी एज के हैं तो कोई भी चाइल्ड अब्यूज़ या एक्सप्लॉयटेशन का फियर नहीं है. They refuse to tell their parents. A nurse has accidentally left papers of the ward patient's detail in the discharge summary file of one of the patients. Next day, the discharged patient called the hospital and informed you about the papers he found. What should you do? Complete an incident form and raise it to the information governance lead. The information governance lead is responsible for storage, कलेक्शन और मैनेजमेंट ऑफ इंफॉर्मेशन. इसलिए हमने उनको इन्फॉर्म करना है क्योंकि उसके डिस्चार्ज पेपर्स रह गए. दिस इज़ केस ऑफ ब्रीच ऑफ कॉन्फिडेंशियलिटी, क्योंकि एक पेशेंट का दूसरे के पास रह गया. द लीड शुड बी इन्फॉर्म्ड सो दे कैन टेक एन अप्रोप्रिएट एक्शन. A patient is brought to the emergency after RT. He is conscious, alert, and oriented. His wife has just arrived to the hospital and asked you about her husband's condition. What should you do? Ask the patient's permission before disclosing any information. No information should be disclosed एक थर्ड पार्टी को जब तक हमें परमिशन ना मिले फ्रॉम द पेशेंट, इवन टू हिज स्पाउस एंड रिलेटिव्स. व्हाट इफ द पेशेंट इज अनकॉन्शियस? You may inform the relatives about the patient's condition unless you strongly believe that the patient would not allow. ठीक है. A 12-year-old boy is brought to you by his mother. She wants a cosmetic surgery for her son's ears as they are sticking out and his school friends bullies him for it. However, the boy refuses operation. तो हम क्या करेंगे? सोशल सर्विसेज को इन्फॉर्म करेंगे और एक्सप्लोर करेंगे देयर कंसर्न्स. Cosmetic procedures are not usually carried by the NHS. However, this case is not entirely cosmetic, as it is a reconstruction of a congenital deformity. We cannot neglect the boy's decision, as this is a surgery which may affect his life. So we may involve social services and explore their concerns. One of the wish is to assess the boy's capacity. At the same time, we cannot rely entirely on his decision as he is below 16, the legal age to make decision in the UK. If it was a life-threatening procedure, we would proceed with the intervention, despite his refusal as he is below 13 and his mother's decision can override the 12-year-old decision. Always lean towards जो कि patient का best interest में है. A lady insists on undergoing sterilization as her last child has cerebral palsy. ठीक है. She has tried many forms of contraception and finally decided to go for sterilization. But her husband refuses. तो respect करना उसकी wishes को. Husband जो भी करे, husband उसका जिम्मेदार नहीं है. A 13-year-old girl present to the GP with her 13-year-old boyfriend. Contraception दे देनी है, same age की है. An 85-year-old woman with advanced dementia. Dementia का patient was admitted for pneumonia. She becomes better but without a full recovery. She insists to leave the hospital. However, her daughter says that leaving the hospital might be unsafe as she lives alone. तो अभी उसको मेंटल कैपेसिटी चेक करनी है, ठीक है, क्योंकि डिमेंशिया है उसे. आज जेहोवाज विटनेस, जब भी जेहोवाज विटनेस आएगा ना और वो ट्रांसफ्यूजन की बात होगी ब्लड प्रोडक्ट्स की, तो हमने आईवी फ्लूइड्स देने हैं. कभी भी ब्लड ट्रांसफ्यूज नहीं करना. While on a restaurant, you found a paper with patient's details on a nearby table which is unattended. What should you do? Look through the paper to find the GP contact or inform करना है GP practice को. What if no contact details are there? Take the paper to the hospital named on it. A schizophrenic young man attends a psychiatric clinic for follow-up. He says that he hears sounds telling him to hurt his ex-girlfriend. He admits that he knows that these sounds are not real, but he sometimes has a tendency to follow them. Suddenly he leaves the clinic before the consultation is ended. तब क्या करना चाहिए? Confidentiality breach करनी है, पुलिस को इन्फॉर्म करना है, उसकी एक्स गर्लफ्रेंड को भी, क्योंकि ये हार्मफुल है to her surroundings. The risk of harming the ex-girlfriend outweighs the patient's privacy. Always consider breaching confidentiality if there is a public interest or if keeping the confidentiality would likely to harm somebody. When to breach confidentiality? अगर जो पेशेंट है gives the consent दे कि हाँ ठीक है बता दो. If keeping confidentiality would likely to harm somebody, तो तब breach करना, जैसे इस केस में. When requested by the law, जब law कहे कि हाँ बताओ. When breaching confidentiality is in the patient's best interest, there is a benefit for the patient who lacks the capacity. A patient was diagnosed with HIV in a genitourinary clinic. He asks not to tell his GP about his diagnosis. What to do? Accept the patient decision और उसके GP को नहीं बताना. This is because the patient can take his antiviral treatment at the GU clinic. Also, AIDS is a blood-borne disease. Disclosure has no public interest. It won't make any differences to the risk of transmission if you break the news to the GP. The case might have been different if the disease is an airborne disease. A patient wants to thank you, so he offers you a valuable hand watch. What should you do? Refuse it and explain to him that doctors are not allowed to receive valuable gifts from patients. Valuable gifts include money and gifts that are of £100 or more. You cannot accept these. You can accept small tokens, symbolic gifts. अगर पेशेंट इंसिस्ट करता है, recommend donating it to a charity or to a department fund. Lorry driver has a seizure but continues to drive, तो हमने DVLA को इन्फॉर्म कर देना है. Mother with Alzheimer's continue to drive. Her son advised her not to do so, but however she insists to drive, तो हमने DVLA को रिपोर्ट करना है. Man has a single TIA and he is now fit for discharge. What should you advise him about car driving? Stop car driving for at least 1 month plus stop lorry or bus driving for 1 year. वही कब DVLA को इन्फॉर्म करना है, ठीक है. अगर कार ड्राइवर है और उसको मल्टीपल TIA जो हैं, lorry या बस ड्राइवर है उसको सिंगल TIA है, you must tell DVLA if you have had any epileptic seizure, fits and blackouts. A man with obstructive sleep apnea, what shall he do regarding driving issue? तो उसको हमने इनकरेज करना है कि वो DVLA को इन्फॉर्म करे. Patient with DVT or pulmonary embolism don't need to inform DVLA and they can drive. No restrictions or driving for DVT or PE patients. An 85-year-old woman with advanced dementia was admitted for pneumonia. A few days later, she becomes better but without a full recovery. She insists to leave the hospital. Her doctor says that leaving the hospital might be unsafe. तो dementia है ना, तो उसके mental capacity assess करनी है. You suspect that one of your colleagues doctor is taking cannabis. तो सबसे पहले confront करना है, senior doctor को inform करना है, GMC को inform करना है. A patient with multiple sclerosis has taken 40 paracetamol pills to end his life. His wife wants him to be treated for paracetamol overdose. He insists not to be treated. तो अब क्या करना है, mental capacity check करनी है. An obese man slept while driving a lorry. He is afraid to lose the job. What is the likely diagnosis? What should be done? तो likely diagnosis क्या है? Obstructive sleep apnea. ठीक है, एकदम से करते करते वो सो गया. Advise him to inform DVLA. अगर वो refuse करते तो खुद ही DVLA को inform करना है. A man with HIV refuses to use condoms and refuses to tell his wife, तो encourage him to tell his wife. अगर वो नहीं सुनता तो उसकी वाइफ को इन्फॉर्म करें through partner notification program. Firstly, the affected patient is asked to inform their spouse within a time frame. If he does not, then the partner notification programs should inform the spouse. An elderly lady with breast cancer has learning difficulty was offered to be on a new medication trial, but her daughter disagreed. What to do next? The patient को refer करना to a psychiatrist to assess her capacity to refuse. 15-year-old girl presents to her GP for contraception. She's having sex with a boy in her class. She doesn't want her parents to know. तो अब क्या करना है? तो इन्फॉर्म नहीं करना, क्योंकि वो और उसका सेक्स पार्टनर are of same age. A man who had chest infection seen by a Y2 doctor who requested chest X-ray. Radiologist report normal finding and the man is treated. Afterwards, abnormal findings are discovered and the patient is notified and treated. What should be done? तो addendum ऐड करना है. No deletion or addendum on the previously added notes. just add a new addendum regarding the recent or new events, तो new events के बारे में, stating new findings with today's date sign, ठीक है ना. A female patient requiring breast examination. She came to the clinic with family and friends. You, as a male doctor, offered a female chaperone, but the patient refuses in the presence of chaperone. What should be done? तो accept her refusal to chaperone. Go ahead and examine her. Document what happened. ठीक है, document कर देना कि क्या हुआ. ठीक है. A chaperone should be offered. However, if the patient refuses the presence, the doctor may proceed without him or her. Nonetheless, he should document the event. A Vito doctor sustained a needle stick injury while taking a sample from an unconscious patient with a history of intravenous drug use. The Department of Public Health recommends that a sample to be taken from the patient for further investigation. तो क्योंकि वो अनकॉन्शियस पेशेंट, जब तक वो कॉन्शियस नहीं हो जाता उसका सैंपल नहीं भेज सकते हम. वेट until the patient is conscious and take consent. You need to wait for the patient to become conscious in order to obtain a consent and send a blood sample to investigate for blood-borne infections. You cannot investigate for infections unless he accepts and consents, except if it is for his best interest. In the given scenario, this sample of blood and analysis are in the doctor's best interest. 45-year-old male presents with a lump on his left testicle. The male doctor offers a chaperone. However, the patient declines. Decline करें तो बस carry on without a chaperone. Document that the patient refused chaperone. A man with HIV refuses to tell his wife about his diagnosis. He promised to use condoms, but he does not want his wife to know about his diagnosis. तो encourage करें उसको कि वो वाइफ को बताए and to bring her for a checkup. अगर वो रिफ्यूज़ करता है तो हम उस पार्टनर नोटिफिकेशन प्रोग्राम के थ्रू बताएंगे, ठीक है, क्योंकि ये सेक्शुअली ट्रांसमिटेड इन्फेक्शन और द कम्युनिकेबल डिजीजेस. ओके, और वाइफ को हमने असेस करना है कि उसको भी तो नहीं हो गया, इसलिए. An elderly woman has been living with dementia. Her neighbor comes to the GP clinic, says that the daughter of the elderly lady is treating her sick mother weird. She locks her mother in house when she goes out. What should be done? तो हमने safeguarding team को inform करना. The local safeguarding team would investigate this issue and try to offer solutions that will not endanger that elderly lady with dementia. There is a risk that this elderly woman would be exposed to neglect, or maybe her daughter is trying to protect her by locking her in house for long periods. However, the safeguarding team and the social services would speak to the daughter and know her intentions and work together to provide appropriate solution. The police might be involved if the safeguarding teams feels that the elderly mother is being abused and neglected by her daughter.